Sean and Christine. And next slide, please. So welcome everybody to the International Alliance of Academies of Childhood Disability in conjunction with the Australasian Academy of Cerebral Palsy Developmental Medicine and many other academies from around the world in putting this 24-hour program together of listening and sharing from clinicians and researchers about how they have coped in this time of COVID for children and their families with disabilities. So if you don't wish to be recorded either on your camera or orally, please don't comment during the session and turn your camera off. However, we really do encourage people to participate, ask questions in the chat or by speaking. And if you want me to ask your question, you can send the chat to me as a personal comment, and I will then talk to it to the speakers and to everybody else. So we have a number of speakers who are going to be talking today. I've asked that they try to keep to 5 to maximum 6 minutes. And then at the end of each one, there'll be an opportunity for the speaker to look at the chat and for others to comment. And I'll also look at the chat to encourage involvement. So we have Gopi, whose background is in physical therapy from Sri Lanka. Ramanya, who is with Badga in also physical therapists in Sri Lanka. They're sharing their presentation. Oh, I'm so sorry, they're both doing presentation each. They're both physical therapists. Badga is a speech and language therapist. And then Nista is from Nepal, whose background is in physical therapy. So my name is Mary Claire Waugh. I'm a paediatric rehabilitation physician or physiatrist if you're in the US. And I work in Sydney. I have been privileged to be the co-chair of the Australasian Task Force representatives on the International Alliance of Academies around this COVID-19 task force. And Alicia Spittle is the other co-chair from the Oz Academy. The International Committee has got Academy members from the Americas, Australia, the Asian group, China, East Africa, Europe, many spots in Europe, India, Latin America, Mexico and South Africa. So we've got the world covered. And the meetings are always very interesting, late at night and very stimulating. It's been really exciting things to be a part of. So welcome to this session. Welcome to the International Alliance. Welcome to country, if you are in the country and the land that we are sitting and talking and working on, and welcome to this virtual community which we're all a part of. This is our new country to recognise elders and owners and leaders past, present and future of our countries. This is an extraordinary time that we're living through, 2020. And this worldwide event, which has been put together in rapid time by a very experienced and talented group of people, is a wonderful way to connect so that we don't feel so isolated, which I know that the pandemic has made many people feel. We want to learn from you. The information will be collated, and we will be sort of putting themes together that the international group, the international task force will summarise in some form. So first of all, I would like to ask Gopi to take over the talking stick, as they say, and present, and everyone else will go on to mute. And I will monitor the chat. Thank you, Gopi.
Hello. Happy World Cerebral Palsy Day to everyone. This is a day which we all, like particularly parents of children with cerebral palsy and families of children with cerebral palsy, wait for this particular day every year. Not only celebrate, to look for new creation, new innovations, like which sort of will be released, and there are opportunities of new interventions, new innovations, how to help these families, how to reach out to these families. So this is actually a day, I think, better than any other day, we celebrate in our family. That's like, it's a very, very happy moment. And thank you. Like, I'm Gopi Kitnasamy. I'm the head of the rehabilitation services at Merrill J. Fernando Foundation, which is the charitable arm of Dilmatti. And we provide educational and therapeutic services to children with cerebral palsy and other developmental disorders. And our National Center for Children with Cerebral Palsy and Other Developmental Disorders, we have 130 kids who come on a regular basis for therapeutic and educational services. And we also have 3 other centers in the country. We sort of serve nearly 200 to 300 children a day. And we also do a lot of community work, like providing pediatric wheelchairs, screening camps all over the country. So far we have done 2,400 pediatric wheelchairs around the country, and we won an award at the World CP Day as well. And during the lockdown, it was it was shocking, because it's like, I think, never experienced for this, like this generation. And it was we had actually experienced a lot, particularly in this generation. So, but this lockdown was a shocking thing, and we were really upset because the continuity of the services were interrupted. So we actually we were like shocked, and we actually we were wondering how to sort of help these families. Next slide, please. That's when we actually we actually did it like an initiative, like because teletherapy, even though we have been doing in short, like a small way, but like it was like a new initiative at our center, because we created a WhatsApp group, because all these 130 kids are in different classes, in different level according to the ability, functional ability. So we divided them according to the classrooms. We actually had WhatsApp group. So the team, multidisciplinary team, we're able to communicate with them directly. The main idea was to see how we can sort of continue with the services we have been providing, the 24-hour foster care and management. Also, like there were a few kids with the feeding issues, and we were supporting them. So, and also the main important thing was the stress among the families, which was very, like, they have been calling us. The children were crying, and they were like, they wanted to go to the center because they have got used to the routine. And when they were like locked on for 2-3 weeks, because usually the holidays we give is the maximum of 2 weeks. And like after that, they sort of really had some very stressful, and families with a lot of other, because a lot of families were from poor socioeconomic background. And then also they had financial issues and job loss, and like a lot of issues, and they were like really stressful. So we wanted to sort of support the families. So reach out to them to see how to support them. So WhatsApp group was just an initiative which we did, and objectives, like these are the objectives. And next slide, please. So the outcome, we were actually really surprised, because we were wondering whether every family will have a smartphone to access WhatsApp. And but like we were surprised, 114 families out of the 130 were like actively participated. Why I say actively participated, and I have mentioned about engagement of both parents. We usually see just one parent, either a mother or the father. Usually it's a mother. Being a father, I'll accept that. Usually the mother, they take them for therapy and to the center and everything. But during this initiative, we saw I don't know whether it was because it was lockdown and they were like at home, they had time. The whole family, even the sibling, the family members, relatives, they're actively participating. And the most important thing, the creativity, even with very little resources, what they had at home, they're very creative. Like we shared activities to do at home, and they sort of did that, and sort of they were sending the feedback to us so that we could see, and the team were sending the feedback. So that's how we have been communicating. Wonderful. It was a superb experience. I'll actually thank COVID for this, because this was a new experience for us, a new learning thing, which actually which will be useful not only for the children who are coming under our services, also to reach out to other families in the country who are in the rural areas. When we do our wheelchair camps, we have seen families who have never been to a hospital, who have never seen a doctor. So now we can reach out to them. We have a way to reach out to them. So we are like, this is a lot of a learning experience for us. Next slide, please. Definitely there were challenges, like say as I said, some families didn't have smartphones. The data was a bit expensive, and internet connection. They also had loss of pay, job insecurity, very stressful situation. But like, we were able to talk to them, the psychologist in the team, she was able to talk to them, comfort them, and then that also gave them a lot of sort of confident in sort of participating in this initiative. And they were like, throughout the lockdown, they were actively getting involved. And also now, like, we haven't started the full service to the full capacity, but still we have been continuing with like say 1-to-1 session. Then it slowly increased the attendance, and now we have both carrying on. Like, we have the teletherapy session as well as the face-to-face session happening. Next slide, please. So during the lockdown, we actually realized there was a surge in the viewership of the YouTube channel. Then we were wondering, so that is another way of reaching out to these families. And all, like, a lot of mobile networks in Sri Lanka, they offered like free YouTube viewing and stuff like that. So then we decided to start a trilingual YouTube channel, which is dedicated to these families, to sort of, so that they can sort of provide advisors, like even on different activities and stuff like that, sharing therapeutic activities and educational activities via video, which is like short videos in all 3 languages in the local in Sri Lanka. So which was a very good thing, and they like there were a lot of people who were benefited by this. And we also did a lot of webinars to support families with children with special needs. Next slide, please. Today, it's a very special day for us, because we also will be releasing a special screening and management app, actually, which is a disability app, which is will be a teletherapy, telescreening, and also it can like do a lot of other things, like developmental screening and hip surveillance and feeding dysphagia sort of issues, all in one sort of solution. Why we wanted that is, like, definitely after realizing the need for the teletherapy and to go to this and go to the community to reach out to these families. That was the challenging thing we always have. Even when we do a screening camp or the wheelchair distribution, we get only 100 to 150 in a camp. But like, we know that there are like thousands of children in that area, but like the message, or to reach out to them, to help them in their family, we decided this will be a bridging sort of a platform. So we will be launching it at a press conference today, and it will be happening in the evening. That's why I said it's a very, very happy day. And I know it's always happens on a World Cerebral Palsy Day. That way, I'm happy as a parent as well as a profession who's working with these children. Thank you. Thank you, everyone.
Thank you, Gopi. So I know the Academy put out a request, anybody to kind of comment in the chat about what were the biggest challenges related to lockdown for your services. So if you're able to put a comment in there, that would be terrific. My only comment back to you, Gopi, is that a lot of the families in Sydney that I've been linked with, they actually became much closer. They got to see their children more and understand them better during the lockdown. And for some, the homeschooling, which we had to do in Australia, was a huge hit. Some kids really thrived with the homeschooling setup. Alicia really loves your app, thinks it sounds great, as do many of us. And then Christine Imms is also praising you on the lovely presentation. And yeah, praise. No questions there, but that's okay. There's plenty of time for questions to come next. So now we've got, so good timing, not too long, that was 10 minutes. So next we're going to have both Romania and Bagya talking to us about the experience in Sri Lanka. And then finally to Nepal. So thank you to you guys. Over to you. Sorry, I just want to pause. Does anybody want to come off mute and ask a question online and be taped? No, you're all still on mute. I'm taking that as a no. Okay, let's head toward the next speakers, please. Thank you, Romania and Bagya.
Thank you so much. First of all, we would like to wish you all a happy World CP Day. And I'm Romania Fernando. I'm a physiotherapist from Sri Lanka.
Hi, I'm Bhavya Devgiri. I'm a speech and language therapist. We are affiliated to IIT National Center for Children with Disabilities attached to Faculty of Medicine, University of Canada, Sri Lanka.
So today we will be joining in the COVID-19 listening and sharing session to share our experiences on how COVID-19 affects our children with disabilities and how IIT overcame this. Allow me to introduce our topic for the session today as reaching the unreachable, because this was absolutely enlightened. Next slide, please. Yeah, I would like to elaborate the overview of today's session. How the impact of COVID-19 affected, how we explored alternatives, how we initiated the tele-rehab process, how we approached and implemented our process, what were the assessment methods and materials we used, about the referrals and screening system, how we aim to the sustainability and continuation to present. So during the COVID-19 lockdown, IIT came to a standstill overnight. Because of this, it has to face a massive difficulty to acquire services at IIT. Also, our main target of multidisciplinary service provision to our clients was disrupted sadly. So, as a result of that, with the help of pioneers who excelled in this field, we wanted more alternative options to be come up. So we attended many webinars, we searched for many literature reviews, we enhanced our professional awareness, and after all, as a conclusion, we came to know the most ideal service provision to our clients would be the tele-rehab process. This short description of video will now show you all how the overall idea of initiated the telehealth process and how IIT embraced it to its context. The video will be playing now.
It's primarily in the specialties of general practice and rehabilitation medicine. However, the majority of consultations are on basic follow-up inquiries or advice by telephone. Even in high-income countries, there is evidence on more intensive and regular programs designed for patients living in remote areas, especially for chronic health disorders. Clinicians conducted interviews or video interviews through social media platforms. Interventions were provided through discussions, demonstrations, by providing soft copies of materials or sharing videos. On some occasions, even multidisciplinary team discussions were conducted to ensure children were receiving all the interventions they required.
When explaining the process, I'm happy to say that our 33 clinicians from 8 disciplines participated and a large clientele of 1,256 clients database was created. These clients were randomly distributed among our clinicians. We also conducted the tele-rehab process via social media platforms using the hybrid method. We identified needs of individuals and we addressed interventions for them. We had a strong cross-referral system established among clinicians for further management. When explaining the service and in the service provisions, Clinicians identified the best communication and feasible mode to be used to each and every individual. The most feasible communication mode to be used, and always clinicians were educated among themselves via platforms such as Zoom and webinars. Record maintenance and database was up to date. Videos were shared with the consent of clients among the multidisciplinary team for further reviews and management. Confidentiality maintenance was topmost. So now I would like to invite Bhagya Devagiri, our special language therapist, to continue the rest of the presentation. Bhagya, over to you.
Thank you, Romania. I'm going to elaborate more on the numbers and the methods. As you can see, the largest clientele we had was learning disabilities and behavioral disorders, but you may also see a significant number of children who received telehealth for cerebral palsy, autism spectrum disorder, as well as early intervention. And the graph in the right side of this slide shows the first telehealth encounter progress. You can see the majority of the clients that we conducted the services were telehealth follow-ups subsequently. Nearly 20% of children were referred to multidisciplinary care within the team. Approximately 10% of the children received live sessions. However, I want to emphasize that these numbers in this slide only shows the results within the first 3 months of the lockdown. Now, let's have a look at the materials we used. First of all, we have developed a database which includes all eligible clients for the telehealth services, and then we decide a record sheet for gathering information that we done from the telehealth sessions. Soft copies of early intervention programs and the videos also were shared with the parents. And now let's see what has worked with us. When we conducting the telehealth service, we observed that there were many successful outcomes of the process as shown in the previous slides. A happy family, a happy kid, because they were given the opportunity to talk to us during this isolated time period. We could also continue the consistency in multidisciplinary care despite the lockdown. Because of that connectivity and the service provision, we could address many of their needs, leading to performance improvements, including the kids, individual kids. Most of all, it was a new experience for all of us as clinicians, because we could observe the natural environment and how the activity level, which we enable to think differently when we plan in the interventions. Now, here I'm going to show you a video. Now you are seeing this as an excellent example of observing the natural environment. Here you can see how parents use their natural materials to enable their children at homes with our guidance and instructions provided from telehealth services. Okay, now let's focus on what were the experiences we learned from the telehealth services. Accessibility to the service provided was a challenge because of the low proficiency in technology and poor connection facilities in Sri Lanka. Willingness to participation for the telehealth also identified as a barrier when providing the service. Confidentiality of the information shared was a concern. Therefore, we had to bring in certain measures to ensure the confidentiality of the information we shared. Also, inconsistency of parent-clinician rapport building reported and was a disrupt when providing the telehealth services. Now, with all these learnings and experiences in future, we are planning to include telehealth as a regular appointment schedule at IAT. We will also establish awareness program to overcome technological barriers. As you can see in this picture, that there are clients presenting to IAT from all over the country. They have to travel hundreds of miles to reach us. We have identified telehealth as a solution and ideal mode to deliver our intervention to such families in need. Therefore, this will continue as a regular intervention modality at IAT. Now, with the current situation, we have come to a square one because Sri Lanka is going to lock down again. This time, with the experiences that we have, we hope to deliver the service in advance with better results. Thank you.
This is the end of our session, and thank you everyone for joining with us.
Thank you very much. That was a great presentation. I think that worldwide we're all looking to have telehealth as an option going forward, and certainly I think in Australasia, with COVID, has kicked us along to really use telehealth better and more. We've always been traditionalists and sort of sitting back and doing what we always did, but this has made us do something different and made us learn, which is fantastic. I'm just looking to see, there's lots of congratulations. Hello, Sumamali. I was hoping you were going to be present. Christine, Ims, to everybody. It's so clear that there is great benefit from seeing the child and family at home for everyone. I personally, Mary Claire, have felt very honoured to be invited into people's homes and to see what it is that they are working with, and you can see, you know, some real challenges there. So Christine goes on to say, we've had great difficulty building cost-effective service models for this in the past, when with gaining secure, easy access to telehealth with that confidentiality that I think you both mentioned, Ramanya, in your presentations. COVID has given us a chance to do this moving forward, so great presentation. And then Helen Keogh has also said, you know, this is a valid option, which I totally agree with. Is there anybody who would like to speak? Message from Gopi to everyone saying thank you.
So, Mary Claire, I guess my question probably for both the previous presenters would be, were there families for whom they really did not want to engage in this approach to meeting with health professionals?
So we start with Ramanya. Do you want to comment on those who didn't respond, and then to Gopi?
Yeah, so most of the families who engaged with us, they were happy to obtain our services. So there were some barriers, but anyway, we were trying to overcome even that little barrier by anyway finding the telephone numbers, how we always wanted to find a way to contact them. So I would say, like, we were succeeded more than 95% from our clientele. So we would like to get better results from this time also.
Just a quick follow-up. What were the sort of things that families were saying that were making it hard for them?
It was like the technological things and the videoing and sending to us with the poor data connections and low income of the families. They were the barriers, actually.
Okay, so rather than not wanting for you to see into their home, it was more the practicalities more?
Yes, practical. There was really very practical barriers.
Yeah, thank you.
Thanks, Christine. And Gopi, any comments about families who didn't?
Yeah, actually, like this, as I said, out of the 130 families, 114 actually participated on a WhatsApp group. And even that is a big number here. Because we never realized that like everybody were able to use the WhatsApp, but some actually families whom we thought actually misunderstood that they are not going to sort of send us feedbacks, were the one most creative and like with very low resources. You would like I'll share some pictures with you. they even used umbrella, like dark umbrella, to sort of do some activities for children with CVI and low vision to cover and sort of things. So very simple, very innovative things, which actually we learned a lot of things from these parents during this lockdown. And for the others, actually the 16 other families, we actually contacted them over the phone. We like even some of the neighbors were helping them, sort of talking to them, because some didn't even have a phone actually. So they were contacting through the neighbors, and then we have been sort of over the phone, we have been advising them, and we sort of even share the activities with them over the phone. So that's how we have been. And again, the challenges was like definitely the technology, and most importantly, the financial sort of issues that what they had, and that added up a lot of stress to these families. So that's the, yeah.
Exactly.
Thank
I mean,
you.
I think what this the COVID-19 has generated is a great sense of community in smaller groups. We'll go to the last speaker, and then there'll be an opportunity for people to ask more questions and comments. So Sumamali was saying in the commentary, it's not easy for some families that had to use their own telephones, which is true if you don't have enough commentary. But with the dedicated team, and then looking, the future is to look at alternative and sustainable solutions that going forward. Australia has just announced an initiative here where Optus is donating data for needy families, which is fabulous. So we're using the Intel companies to provide some data that we can then get to families so they can connect online. In some countries in the world, New Zealand, for example, I know with the presentation that we did a while back in June, that there are families in New Zealand who don't have access to any technology. They don't have internet, they don't have smartphones, they don't have computers. So that is when you really do need the neighbours and the people who do have a phone to be able to bring together the community. Okay, on to our last speaker. So Nistha is a physical therapist in Nepal. So over to you.
Thank you so much. Am I audible? Yeah, okay, thank you. So would like to introduce myself again. I'm Nistha Shrestha. I'm lecturer at Kathmandu University School of Medical Science and pediatric physiotherapist at Thulikhel Hospital, which is a Kathmandu University Hospital. So would like to highlight about the impact of COVID-19 on children with disabilities in Nepal. Next slide, please. So as we know about the global pandemic situation, the statistics worldwide is around 33.4 million cases, and there are death rate of 1 million cases. But moving on to Nepal, next slide, please. Yeah, Nepal. I guess I just want to briefly tell about Nepal. It is between two big countries, India and China, and we have a population of around 30 million. And the COVID cases started in Nepal from starting of the May, and there was first spike where all the lockdown has started, and the lockdown was there for almost 3 months. And following that, there was some type of services resumed after the case was decreased, but immediately after the service had resumed, there was a second spike, and continuously we are having increase in cases every day. Total cases on 30th September, the data was around 77,000, where there was 26.85% active cases, and we had a death of 0.64%, and we are lucky that we have more recovery rate as well, that is 72.51%. Next slide, please. And government of Nepal, they have categorized the cases based on the age group. Mostly the age group from 0 to 20 is there are around 12.50% cases around 0 to 20 years age group. But government of Nepal they have not provided the exact data about children with disabilities who has COVID-19. So we lack about the proper data from the government aspect on this. Next slide, please. Next. Yeah, so highlighting about the impact of COVID-19 for children with disabilities in Nepal, there are few areas I especially would like to highlight, that is education and learning. Since past 6 months, there is lockdown in Nepal. So the lockdown has led to shutdown of all the special schools, integrated schools and normal schools, which has few school has adopted some type of virtual or online classes, but as Nepal is low middle income country and 80% of the people, they still live in the rural area. So accessing to technology has been a very big challenge, and there are increase in dropouts, mostly in education sectors. About the financial aspect, the low and middle income country businesses has also been like shut down, which has caused a huge impact in finance, not only for normal people, not only for parents or caregiver of children with disabilities, but most of them. Government of Nepal has tried to provide service based on the severity of the disabilities, and they have provided some financial benefits and schemes, but it's very minimal, so it's really difficult to sustain the family. The next one is, next please, about the mental health and child protections. We have noted many cases of increase in stress, anxiety, and behavior change as the children, they are staying in lockdown for many months now. So there is an increase in stress level in the children with disabilities. Plus, about the child protections, there are many cases noted in the rural area about child abuse, especially mostly on the rural area, and also with the children having disabilities. I've personally noted with a few of my patients, and like not only children, but children, mother of the children also, like they have been facing some type of abuses. So the protection is really required, I guess. And another slide, yes, thank you. So the huge impact is also there in healthcare service. Next slide, please. So as I work in a setup, it's an acute setup, but we do have a community outreach center. So Dhulikhel Hospital it is a tertiary hospital. It's also a community hospital, and now it's labeled as a level 3 COVID hospital by government of Nepal. There are 4 level 3 COVID hospital, in which one of the hospital is Dhulikhel Hospital, where I work. So as a physiotherapist, we are trying to provide service in inpatient, outpatients, and all the required field. But the main challenges that we are facing is during providing the service in inpatient setup, we face that we have been facing difficulty to maintain the social distancing. We are trying to maintain all the safety precautionary measures and apply all the necessary safety gears, but we still have an area to improve on this. About the outpatient service, we have only 5% of follow-up rate, and the follow-up case that we had has we have difficulty in following up with the cases. And if there are any cases that are noted in they come for outpatient service visit, then we are trying to include more of the service in the outdoor area rather than providing service indoors. We are also trying to include technology to our service, but telehealth service, it's very new for us. And as I mentioned, Nepal is a country where 80% of the people are in rural areas, and it's still difficult for them to reach with the internet facilities. So telehealth service, it's still a challenge for us. Next slide, please. So what are the ways that we have adopted is, as Dhulikhel Hospital is the main hospital where I work, but we also have 21 outreach centers in the core rural areas of Nepal, in different different provinces of Nepal. Can you just add the next pictures? Yeah, thank you. So what we are doing is we are trying to collaborate with the outreach centers and trying to include any type of services. Physios who were regularly practicing the services in the outreach centers, they are continuously providing. In rural area, the COVID cases is not so much high because of the geographical area also, and the houses are very much in isolated areas. It's very much far away from one another, so the cases are not so much. So physios are trying to provide services there as regularly, but we are also trying to collaborate from the central, our Dhulikhel hospital, with the outreach centers and provide services at the local communities also. Next slide, please. Yeah, and the most important thing we felt during this COVID situation is educating the children and caregiver about the COVID-19 situations, about the precautionary and safety measures that they have to follow, and about including the telehealth plus home-based intervention sessions. For this, we had developed various type of pamphlets, videos, and education materials that we had distributed through various type of media service and through our outreach centers also. Next, please. Next. Yeah. So what is our future learning is, next slide. The main thing is multidisciplinary team, but including the community stakeholders. As children, they can't come for children and the caregiver, they can't come for seeking for the services that we provide. We have tried to reach to them and provide services in the community level. Task management and team management was the greatest learning that we had during this COVID-19 because of the uncertainty in the situations. The main thing about the primary prevention strategies about maintaining hygiene, safety, and sanitizations, we were regularly taking different types of classes and conducting various type of programs, but we think this has increased in priority level. Like, we have to work more on the safety measures at the rural and community area, including the technology is one of the more core area that we have learned, but the important thing is conducting more of community-based intervention services, and including the services on the outdoor environment has been one of the key area, and referring child and caregivers to mental health experts and helping them to cope up with any kind of stressful situation has been one of our main agendas. So next slide. With this, I would like to wish everyone a happy World Cerebral Palsy Day. And I think we'll get through this pandemic. And thank you so much. Next slide, please. Thank you. Thank you so much.
Thank you so very much. Okay, so there's a little bit of chat happening. So I was wondering if, Nistha, there's any opportunity for families to access DVDs. Is that something that they could use if they didn't have access to smartphones or iPads or telehealth? Are DVDs an option?
Really? It's what we, DVD is also, I'm just talking about the core rural area and not the urban part. Urban part, they have a huge facilities and they have great access. But where I work, it's more focused on the rural communities and areas. So what we have is we have different outreach centers. So normally, if you want to disseminate any information, we provide the DVDs, CDs, or posters or pamphlets to the outreach centers, and they do disseminate to all the community areas. So that's how we are working.
Okay, well done. Because I think that some of the dissemination of what we do as clinicians into the community and how we provide therapy or interventions or management is about upskilling our families and the carers and the local team to do that kind of level. I wondered if anybody in the program, or I think we've got 61, 2, 3, how many people? We've got 64 people. Has anybody seen any children go backwards as a result of not having their therapy interventions that you usually provide? And I'll just see if anybody waves or hits the reaction button saying yes, no, maybe. I haven't got
Very clear. Not exactly that from, but from our session this morning with from presentations from Melbourne and Fiji and Kiribati. There was some comments from the Melbourne group about helping some families to decide that they needed to come into the hospital rather than stay home. So, so addressing where things were not going so well, and the clinicians really felt they needed to see the child and family, helping families make that decision to come into the hospital, whereas they their comfort levels were to be at home and no, I'm not going out there. Kind of approach, I guess. So that was sort of one of the comments that was made.
It's similar in Nepal. We really have to counsel parents so much to get the service that is required, because everyone is very much scared to be in the hospital. Plus, most of the hospitals and setup, government has instructed most of the private, community and government hospital to allocate 20% of their bed for COVID patients. So most of the hospital is like every hospital has COVID cases now. So it's really difficult for parents to decide to come to hospital to get the services. So it's really difficult.
It is a challenge, isn't it? And it's also a challenge for clinicians, I think, actually working in these centres and hospitals where you do have COVID cases. And certainly in Sydney in Australia, and more recently in Melbourne with the numbers of hospital-based workers becoming unwell, there was a real fear for us as clinicians and then taking it home to our families and spreading it within our community. So there was great enthusiasm here to do telehealth, but also to work from home using online platforms and VPN and the like, so we could access files and records. So we were lucky that Australia is reasonably well connected, you know, with the internet and the like. And then getting people to come back in. You know, there are some families who just will not. And the same with school. They wouldn't send them back to school because they were very afraid that in the school environment that their children with disabilities would become very ill and sick and die. I don't know what the incidence rate is of COVID in the world. Certainly children in Australia have been largely not unaffected, but less affected. But obviously, if a child has got cerebral palsy or, you know, especially with spastic quadriplegia, GMSCS 4-5, they're probably more medically fragile, so therefore at risk. But I don't know what the numbers are with regards to kids with disability who have COVID and what that's like. I think overall they have a better outcome, less severe infections and better recovery, but I don't know. I don't know the facts around that. If anybody does, that'd be great. Post it in the chat. So Christine also made a comment, wouldn't it be wonderful to have an international collaboration from our region addressing these issues at the conference 2022? So Alicia has also put in the chat that the Australasian Academy and the International Alliance meeting is going to be in Melbourne in 2022. There will be, the International Task Force is going to put together something that hopefully will get a Guernsey and get a platform presentation, sorry, not a Guernsey. So to share this very experience of working internationally. So the International Task Force is looking at supporting clinicians and families during this time, providing resources online that will help with therapy delivery and service delivery. And then thirdly, to look at surveys that have been done to find out about what has been the experience of not only clinicians but families with a young person or young people with disability during COVID from the international perspective, and then dividing that up between various countries. And obviously the experience in Australia and New Zealand will be very different to the experience, say, in the US or Belgium, where the numbers are hugely higher. Okay.
Just to answer your question, we've had at the University of Melbourne in the Department of Paediatrics a weekly update on research that's come out from around the world around how are the kids doing, so COVID-19 kids research. So I'm going to put a link into the chat. If somebody would click on it and just tell me if it's a open access for everybody or if it's only I have access because I'm a Melbourne University person. Is that okay to do that? Just because it's...
Yeah, go for it.
So basically the way the Department of Paediatrics has done this has been to, oh, hang on a minute, I've got to...
Not there yet, you have to...
We also put it on Twitter, Christine, so hopefully it is available to everyone.
Yeah.
I'm pretty sure it goes onto Twitter, but...
yeah, it's just very good. Actually, I think need to go to everyone. Sorry. So it's just been really amazing. So what the department's done is brought together all of their medical students, and so they divvy out all of the reviews of the work, and that's supervised by the academics from the Department of Paediatrics as a process.
Great. Yep,
so,
definitely. So I linked it and I can open it. So
perfect. So that's great. So that's a really a week by week update on the latest evidence specifically related to children and COVID. Because my understanding is that the effects are much less, regardless of course, if you're more vulnerable, you're more vulnerable.
Yeah, and I think it's the vulnerability of the group of children with disability. And then again, within CP, whether you're GMSCS1 versus GMSCS5, you know, how you cope with...
Have a respiratory problem otherwise, yeah.
Exactly, exactly. Okay, well, great timing, everybody. We've got lots of thank yous, lots of praise. Are there any burning issues or anything that anyone would like to add to the discussion about what you did in your particular service that was interesting, different, new? The sense I'm getting from the presentations that I've been involved with is that it is quite traumatic, not only for families, but for clinicians. And the sense of isolation and risk to mental health, the longer it goes on, the worse it gets. And the fear of getting back into the community is very real, going back to school or going back to the hospital. But in the sense that there have been many positives that have come out of this, I think the sense of community and the sense of looking after the people around you, keeping your community safe in your small bubble is actually quite a useful exercise in building supports locally. Telehealth has been amazing to be able to do this, and we're very privileged to be able to go into people's families and into people's homes and see the kids there. I mean, I've met more dogs and cats and one rabbit online. It's wonderful, you know, to be able to look into people's houses and see where they are, and that's a very private, personal space that we should feel very privileged to see. But telehealth is here to stay, and I think it's going to continue on for forever. I mean, it's going to be part of our service from here on in, and there are many family that I think would benefit from it. But there's a great opportunity here for us as the Oz Academy, the International Alliance of Academies, because that's what we all belong to actually provide information online, load up your presentations and your talks, and people who can access it do, and those who can't can download it onto a disk and take it to the rural communities in Australia, New Zealand, Nepal, India, everywhere, so that others benefit from your knowledge and what you've got to offer to share. But then you get a chance to hear what they've got to say, because they can tell us an awful lot about how we can do it better. Okay, where are we time-wise? We've got 3 minutes.
The only other thing, Mary Claire, I'd like to add, and we were talking about it earlier, is the whole concept of these sessions. And I guess one of the good things to come from COVID is it's made us realise that the world is very small and we can connect with people. And Zoom can be a very, very good thing. It can be tiring too, but it has many good features. So I guess from you, if people who have joined us today, if there's things that you think that we could do in the future, please let us know, because the idea of these sessions is to help share our ideas to make us feel less isolated. But if there's any other topics or ideas that you have, please let us know.
Thank you, Alicia. And I must say that Alicia and Jenny from Ireland have been instrumental in getting this international link set up for us. So thank you, Alicia. Great job. And thank you to Sian, who's the tech person at the Academy, who's making it all work. Don't rely on me. I hope the rest of the day and the week and celebrating and launching all of your new products and supporting your families is a good one. So take care, wash your hands, and we'll see you at the next Zoom, whatever it might be.
Thanks, everybody.
Bye-bye.
Thank you. Bye.